Welcome to the Tobacco Online Policy Seminar, TOPS. Thank you for joining us today. I'm Dr. Chris Lowenstein, an incoming postdoctoral fellow at the University of Missouri. TOPS is organized by Mike Pesco at University of Missouri, C. Shang at The Ohio State University, Michael Darden at Johns Hopkins University, Jamie Hartman Boyce at University of Massachusetts Amherst, and Justin White at Boston University. The seminar will be 1 hour with questions from the moderator and discussant. The audience may pose questions and comments in the Q&A panel, and the moderator will draw from these questions and comments in conversation with the presenter. Please review the guidelines on tobaccopolicy.org for acceptable questions. Please keep the questions professional and related to the research being discussed. Questions that meet the seminar series guidelines will be shared with the presenter afterwards, even if they are not read aloud. Your questions are very much appreciated. This presentation is being video recorded and will be made available along with presentation slides on the TOPS website, tobaccopolicy.org. I will now turn the presentation over to today's moderator, Justin White from Boston University, to introduce the speaker.
Today, we continue our summer 2025 season with a single paper presentation by Shweta Mital entitled Are E-Cigarettes Substitutes or Complements to Combustible Cigarettes Among Youths? Evidence from Canada. This presentation was selected by a competitive review process by submission through the TOPS website. Shweta Mital is a health economist and assistant professor at the University of Manitoba. She earned her PhD in 2021 from Memorial University and completed a postdoctoral fellowship there before joining the University of Manitoba in 2023. Her research spans two areas of health economics, namely evaluation of health policies, particularly substance use policies, and health technology assessment. Dr. Hai Nguyen, a professor at Memorial University, is a co-author of the study and will answer select questions in the Q&A. Dr. Mital, thank you for presenting for us today.
Thank you very much for the kind introduction. I'll now share my slides. I hope the slides are on your screen now.
Yeah, looks good.
Right. Good afternoon, everyone, and thank you very much for giving me the opportunity to be presenting this work here today. I'm very excited to present this work that I've co-authored with Hai Nguyen. And in this paper, we essentially revisit the question of whether e-cigarettes are substitutes or complements to combustible cigarettes among youth, but with a slight twist. And I'll come to that in a bit. First, some disclosures. The funding for this study came from the Canadian Institute of Health Research and the Canada Research Has program. I have no conflicts to disclose in terms of funding from tobacco-related sources. So as researchers and others interested in the field of tobacco-related research, it's probably not surprising to you that smoking among youth has gone down recently, both in the United States and in Canada. So the graph on the left shows the decline in youth smoking among youth aged about 12 to 19 years in Canada. And at the same time, however, vaping among youth has gone up. And so the graph on the right shows that between 2015-16 and 2018-19, youth vaping has risen from about 29% to 45%. That's about 1.5 times increase. And that's the red line up there. So then the obvious question then is, what is the relationship between these two phenomena? Is youth smoking going down because youth are substituting vaping for smoking? Now, those who oppose e-cigarettes would argue that the decline in smoking started well before e-cigarettes came into the market. And so this decline is not really attributable to e-cigarettes. In fact, they would say e-cigarettes are a gateway to smoking. But then those who support e-cigarettes would say the recent declines in smoking are much larger than what we've seen in earlier years. And if e-cigarettes were indeed a gateway to smoking, then we should have seen a resurgence in smoking when vaping increased, but we don't really see that. So this debate essentially boils down to the question, are e-cigarettes substitutes or complements to combustible cigarettes? Now, There's a growing literature, particularly in the United States, that has sought to answer this substitution versus complementarity debate using the minimum legal age law for electronic cigarettes as a source of exogenous variation in youth vaping. But this literature has come to mixed conclusions. So some of the earlier studies that used aggregate level data found that the minimum legal age laws for e-cigarettes increase cigarette use. And if these laws also reduce e-cigarette use, which we would expect if these laws are effective, then e-cigarettes and cigarettes would be substitutes. Then the later studies that used individual level data found mixed results. Some of them found a reduction in cigarette use associated with the minimum legal age law for e-cigarettes. Others found an increase. There's also a broader literature that's again try to address the substitution versus complementarity question using a number of other policies as exogenous to identify these effects, which include cigarette and e-cigarette taxes, ban on electronic nicotine delivery systems in Massachusetts, which was implemented in 2020, and bans on flavored vaping products. And again, this literature comes to mixed conclusions depending on which policies being used to identify the effects, which age group the study is looking at. But more or less, these studies point towards a substitution story, that e-cigarettes and combustible cigarettes are substitutes. What is, however, lacking so far is that no study has really teased out the effect of the laws on smoking initiation and cessation separately. So in this study, we revisit the question of whether the e-cigarettes and combustible cigarettes are substitutes or complements, again using the minimum legal age law for e-cigarettes as a source of exogenous variation in youth vaping. But we go beyond looking at just the effect of the laws on smoking participation to try to identify the mechanisms through which these effects come about. So specifically, do these laws increase or reduce smoking initiation, smoking cessation, or both? So let's talk a little bit more about these mechanisms. So you can think of the effect of these laws on smoking participation or prevalence as a combination of the effect on smoking initiation and the effect on smoking cessation. Now, in terms of smoking initiation, for those who have never smoked, what we would expect is that the e-cigarette minimum legal age would reduce access to e-cigarettes and therefore reduce initiation of e-cigarettes. And if e-cigarettes are a gateway to combustible cigarettes, then we would expect these laws to also discourage smoking initiation. But at the same time, now that these laws are making e-cigarettes less accessible, and these are youth who have never smoked before, they may be more likely to start smoking instead. Then talking about cessation, for those who are currently smoking, a lot of these people often use e-cigarettes as a smoking cessation tool. And so when the minimum legal age law makes e-cigarettes less available, less accessible, these individuals might continue to smoke. And so it may make them less likely to quit smoking. So then the effect on smoking participation is driven by actually what happens on what happens to smoking initiation, what happens to smoking cessation. That would determine the combined effect on smoking prevalence. So we basically try to tease apart these two effects on initiation and cessation. How do we do that? We basically explored the variation in the adoption of minimum legal age law across Canadian provinces. So between 2015 and 2017, 8 of the 10 Canadian provinces adopted the minimum legal age law. 2 of these, Quebec and Manitoba, set the minimum legal age at 18, and the others set the minimum legal age at 19. And then in May of 2018, the federal minimum legal age law came about, and they set the minimum legal age at 18 across the board. So we use the two-way fixed effects model, where we regress the outcome on the minimum legal age law, which is the difference in differences term, We control for individual level demographic characteristics, age, sex, and household size, province level time varying factors, cigarette price, unemployment rate to control for the economic climate in the province and the presence of menthol cigarette bans. And of course, we include province and time fixed effects. We estimate this difference in differences model using an ordinary least squares regression. And in the context of Canada, where we have 10 provinces, we face the challenge of small number of clusters. And so we use the effective number of clusters method by Carter-Schneppel and Steger-Ward for statistical inference to account for these small number of clusters. We additionally use a triple differences design where we also compare outcomes between the youth who are below the minimum legal age and who are therefore targeted by this law, and those who are above the minimum legal age but are below age 24, just to keep the treated and control age groups as comparable as possible. In terms of outcomes, we look at two participation outcomes, whether or not the respondent ever smoked and whether or not they currently smoke. In terms of initiation, we look at past 12-month smoking initiation overall, and then broken down into whether the initiation is into regular smoking or into experimental smoking. And in terms of smoking cessation, we looked at past 12 months smoking cessation. All of these are binary outcomes, yes, no outcomes. The data for these outcomes comes from the Canadian Tobacco Use Monitoring Survey, which is a nationally representative survey of Canadians, and its replacement, the Canadian Tobacco, Alcohol, and Drugs Survey. We also use another survey, the Youth Smoking Survey, and its replacement, the Canadian Student Tobacco, Alcohol, and Drugs Survey, which is again nationally representative survey, but of youth only in grades 6 to 12. And we use these surveys in a robustness check. The study period of our analysis is from 2004 to 2017. There were two reasons why we stopped at 2017. First, the federal minimum legal age law came about in 2018. And so after that, all provinces essentially become treated provinces. And so given the recent advances in the difference in differences literature, if we were to compare these treated provinces that became treated after the federal minimum legal age law came about with provinces that had implemented the law earlier, then we would run into the issue of forbidden comparisons, and the two-way fixed effects estimates would likely be biased. So that was the first reason why we stopped in 2017. The second reason was more of a logistical issue. The data on initiation and cessation outcomes were available only up to 2017. Now I show you the survey questions that we use to to construct these outcomes. We first looked at the ever cigarette use, which was based on the question, have you ever smoked a whole cigarette? We also then looked at current smoking, which followed the standard Statistics Canada definition of a current smoker, which is basically a person who currently smokes cigarettes daily or occasionally. For smoking initiation in the past 12 months, there was no survey question that directly asked respondents whether or not they started smoking in the past 12 months, but we do know from the survey the age at which they started smoking and their current age. So we match those two to see if the two ages match, then we say that the person started smoking in the past 12 months. And then based on whether they said they're a current smoker or an experimental smoker, we classified them into initiation into regular smoking versus experimental smoking. And then the past 12-month smoking cessation outcome was based on the question, when did you stop smoking? So if they said they stopped smoking less than a year ago, then they were classified as having quit in the past 12 months, and otherwise they were not. So I guess we'll stop here for questions if anyone has any.
Great, thanks so much. I want to encourage our audience to keep placing questions in the Q&A panel. And now we're going to turn to our discussant. Our discussant today is Dr. Revati Suryanarayana, an assistant professor at the O'Donnell School of Public Health at UT Southwestern Medical Center. Her research sits at the intersection of health economics and public policy, with ongoing work investigating how tobacco regulations influence consumer choices around cigarettes and other harm reduction products across multiple countries. So, Revati, do you have any questions at this stage for Shweta?
Yeah. So thanks so much, Justin, for the introduction. And thank you, Shweta, and the organizers of TOPS for allowing me to discuss the paper. I really enjoyed reading the paper. I thought it was very thoughtful and very well written draft. And I really appreciated how you went beyond thinking just about smoking prevalence and tried to distinguish between smoking cessation and smoking initiation, and also the careful discussion of the mechanisms behind how these two products, e-cigarettes and combustible cigarettes, would be interacting. So at this point, I had two questions, which sort of delves into the background at this point of your sample time period. So the first question is about youth tobacco use patterns. So I was just wondering what the broader landscape of e-cigarette use was among youth. So what do we know something about?
Sorry, I thought the
I
voice.
think, yeah, the audio is frozen on my end. Is that for you too, Shweta?
Yes, yes.
Okay. Revati, are you there with us? Okay, maybe I'll jump in with one clarifying question, and hopefully she'll join us in a second. So you mentioned that two of the provinces had different age cutoffs. I think it was Quebec and Manitoba, and I was curious. So I think that would presumably affect your triple differences in terms of who the targeted group or not is. Did you make any other sort of accommodation for the fact that there were different legal age cutoffs for those provinces?
Yes, definitely. So the target age was the minimum legal age was used as the cutoff. So for the provinces that had 18 as the minimum legal age, the control age group started from 19 and onwards. 18 and above, and for those that had 19 as the minimum legal age, we defined it accordingly. It's 19 and above was the control age group in the
Okay,
triple.
great. So I'm not seeing any other questions in the Q&A. I think Revati can jump in when she comes back, hopefully at the end. And so I would say maybe feel free to continue.
Great. So then moving on to the results. So I'll first show you the trends in smoking participation. So these graphs show the trends in participation both in the provinces that did and did not adopt the minimum legal age law. So the solid line represents participation in provinces that adopted the minimum legal age law at some point, and the dashed lines are provinces that never adopted the law. The two vertical lines represent the time period between which the provinces adopted the minimum legal age law, which is between 2015 and 2017. And again, there's staggered adoption here. So what you'll notice here is that there's a downward trend in participation, continuous downward trend in both provinces that did and did not adopt the law. Now, we are in the context of staggered adoption, so there's not a lot that we can make out for the 2015 to 2017 time period in terms of differences or between the provinces that did and did not adopt the law. But overall, there doesn't seem to be a lot happening, and the trends don't seem to diverge very much. Here are the differences results. So I show you the results for the full sample. And then we also look at the two age groups, 15 to 16 and 17 to 18. And the reason we break down into two age groups is to see whether the effects are different for youth who are closer to the minimum legal age and those who are further away. So you can see from this table here, there's no effect of the minimum legal age law on smoking participation, either in the full sample or in the two age groups of 15 to 16 and 17 to 18-year-olds. And then here are the difference in the triple difference analysis results. And again, they support the difference in difference results that there's no effect of the laws on smoking participation. Now let's turn to the mechanisms where there's a lot more going on. And so you'll see from the first column here that the minimum legal age law had an overall led to an overall reduction in smoking initiation in the past 12 months. And this reduction is driven by almost similar reductions in initiation into both regular smoking and into experimental smoking, although the coefficient is only statistically significant for experimental smoking. And then in terms of smoking cessation, again, the coefficient is negative, although it's imprecisely estimated, but it's of a negative sign. And these effects, this reduction in both smoking initiation and possibly smoking cessation, is concentrated largely among the 17 to 18-year-olds. I would want to mention here that the imprecise estimate for smoking cessation is likely due to the smaller sample size of the current smokers in our sample. The triple difference results again support the difference in differences results. So again, a reduction in smoking initiation and a smoking cessation, which is largely concentrated among 17 to 18-year-olds. So overall, these results then suggest that there's a null effect on participation, but there's a reduction in smoking initiation, which is offset by a reduction in cessation, and these effects are concentrated among the older youth who are closer to the minimum legal age. Now we are in the context of staggered policy adoption, and from the recent difference in differences literature, in the context of staggered policy adoption, where there is heterogeneous policy effects, the two-way fixed effects estimates are likely to be biased. And so we used Bacon decomposition to break down our two-way fixed effects estimate and weight the good versus bad comparisons. And so what we noticed is that most 99% of our comparisons are actually good comparisons, where we are comparing either comparing the treated provinces to never treated provinces, or we are comparing early treated provinces to late treated provinces, using late treated provinces as controls. Only about 1% of our comparisons are forbidden comparisons, where we are comparing the late provinces using early treated provinces as controls. And even so, you'll notice that the sign of these coefficients of these 2x2 estimates are similar to that in the good comparisons. Now, staggered policy adoption and the bias in two-way fixed effects estimates would arise, and the problem of negative weights in this context would arise only if the policy effects are heterogeneous. So we next used the test for homogeneity by Jakila, which essentially relies on the idea that the treatment of the policy effects in this context would be homogeneous if the residualized outcome, which basically partials out the effect of which is basically partialing out the effect of province and year fixed effects. The relationship of that residualized outcome with residualized treatment, if that is linear, then the policy effects are homogeneous, which basically then translates into the fact that the slope is the same between the treatment and the control provinces. So what you'll notice here is that when we apply this to our context, the coefficients on the interaction term are not statistically significant for any of the outcomes, meaning thereby that the slope does not differ between provinces that did versus did not adopt the minimum legal age law. So together, this test for homogeneity and Bacon decomposition suggests that the two-way fixed effects estimates are unlikely to be biased in our context. We also test for pre-policy trends in outcomes, and you'll see from these graphs, there's no significant difference in trends between treated and control provinces in the pre-policy period. And then we also did a bunch of robustness checks where we restricted the time period to 2010 to 2017, essentially to rule out any effects of historical policies. We also controlled for province-specific linear time trends. We controlled for vape-free air laws that a number of provinces implemented. We restricted the age group to up to age 22 instead of up to age 24 in the triple difference analysis, just to see if the control age group would have any effect on our estimates. We also excluded provinces that adopted the menthol ban at the same time. 3 provinces adopted it at the same time: Nova Scotia, Quebec, and Ontario. We excluded those. And as I mentioned earlier, we used another survey, the youth smoking survey, and its replacement, and ran the same analyses again. And in all of these analyses, our main findings continued to hold, which is that there's no effect on smoking participation, and our effects on smoking initiation and cessation also continued to hold. So to summarize then, what we find is that the minimum legal age law for e-cigarettes have no effect on smoking participation, but these null effects are actually masking a reduction in smoking initiation that's being offset by a reduction in smoking cessation. And these effects are particularly driven by the 17 to 18-year-olds. What does that mean for the relationship between e-cigarettes and combustible cigarettes then? It depends on the smoking status of people. So if we are looking at never smokers, then the relationship between combustible cigarettes and electronic cigarettes is likely that of complements. Whereas if we are looking at existing smokers, then the relationship is that of substitutes. Then going back to the point from where I started, these findings then explain why the rising e-cigarette use did not have any effect on the declining trend in combustible cigarette use that we've seen in recent years. What does that imply from a policy perspective? Well, it first of all alleviates concerns that minimum legal age laws will induce youth to switch to combustible cigarettes. Perhaps it may actually prevent these youth from starting smoking. But at the same time, policymakers need to consider the possible negative consequences of these laws on smoking cessation, because these existing smokers may be less likely to quit. Thank you very much, and I'd be happy to take any questions.
Thanks so much. That was great. Revati, I think you're back with us. Do you want to ask any questions that you have?
I'll attempt to ask questions before I cut off again. Apologize for that. But the first question I had with respect to the results is essentially you're looking at sort of the second stage of a law that affects e-cigarettes, right? ML. So I was wondering if you had any thoughts on how this is affecting the first stage, which is how does this law or how has it changed e-cigarette use among youths? So do you have any statistics on that, or do you have any evidence for that?
Yes, a great question. We actually did another, my co-author actually published another study where we looked at the effects of the minimum legal age law on electronic cigarette use among youth, the same age group. And the conclusion of that study was that there was still an increase in e-cigarette use, but that the rate of increase was lower after the minimum legal age law came into force. So the law did not reverse the trend in e-cigarette use among youth, but it slowed down the increase.
I see. So which brings me to another question which I had for the first part, but I couldn't ask, which is, do you, because the central identification in the paper is essentially relying on differences in how MLA laws were enforced across provinces. I was wondering if you can talk a little bit more about how these laws were actually enforced on the ground. So was there a real variation in terms of how strictly they were implemented, or monitored across provinces, and just to get a sense of what was it from the perspective of young adults and retailers who were trying to access e-cigarettes at this time?
So there is, as again, this goes back to the previous study, and so there we looked at the ease of access, and you did say that there was the ease of access to e-cigarettes became harder after the laws. But then they also try to rely on social sources more. So on the one hand, the minimum legal age law is restricting them, but then they are switching to more to social sources. So
Okay.
that is a bit of a policy issue that needs to be monitored, I guess.
Yeah. And just one last question, when we think about the broader policy implications, because this is young adults and the age group that you're looking at is usually the time when they're not just using e-cigarettes and cigarettes, or they're also thinking of other risky health behaviors like alcohol consumption and cannabis use. So have you considered whether these laws, now that it's in effect in the whole country, and it's been almost 5 years, right, or 7 years, if my math is right, but I'm just curious whether there could be sort of unintended consequences or complementarities in these domains as well?
That's a great point. We haven't looked at the effects of the laws on other substances, but that's certainly feasible, given there is data on other substances, and would be worth looking into.
Yeah, that's all the questions I have, Justin. And sorry for cutting off earlier.
No problem at all. Okay, great. So we do have one question in the Q&A still, and I'd encourage anyone else who has questions to feel free to add any. So this is a question from Ginny Chadwick, who's asking about, do you suspect that the reduction in cessation is a result in misunderstanding of sales versus up laws, that's purchase use possession laws, so the sales versus sort of regulating purchase use possession, in that the way even in this research is framing the law is minimum legal age versus minimum legal sales age, and so basically asking about that relationship, as well as is the law actually penalizing purchase use possession and not just sales in Canada?
So the law is penalizing sales, not possession. And if I've understood the question correctly, the smoking cessation outcome is basically asking asking respondents whether or not they quit in the past 12 months. So that doesn't really, it's not directly related to whether or not, or doesn't have a minimum legal age connotation there. I don't know if I've understood the question correctly.
I think I interpret it as whether or not, yeah, so I'm not 100% sure, but I think the idea that do the youth think that sales is being regulated, or do they think that use and possession is being regulated? In here, Ginny is clarifying, research has shown that when individuals think their behavior is illegal, they're less likely to seek treatment. So in other words, maybe she's wondering if there's misreporting because people might think that they're admitting to illegal behavior. I think do you think that there are reporting biases, I guess is how I would characterize it.
So with survey data, there is, and these are youth, there is a possibility of desirability bias and reporting biases, but I think it's fairly clear that these are restrictions on sales, because there are so whenever these youth go to a store to purchase, they have verification of identity and all that. So it's not just about possession, but sales.
And there's a question from Mike Pesco. This is actually in the chat for panelists. Any reason why the structural relationship between smoking and vaping among youth would be different in the US versus Canada as of the end of 2018? So how do you sort of reconcile your results versus other published findings in the literature?
So a number of factors could play a role. So first of all, the minimum legal age in the US is, I believe, now been increased to 21. So whether or not the 18 to 20-year-olds would have a similar use pattern and similar substitution pattern is something to think about. There are also the other vape-free air laws and smoke-free air laws that are different in Canada versus in the United States. So those might also play a role in changing the relationship. Those are some of the factors that I can think of that might lead to differences.
And Mike has another question for you. The initiation and cessation measures are as of the past 12 months. Could you use a combination of the ever question, 12-month change question, and current question to construct an alternative outcome that would be initiation or cessation more than 12 months ago? And he says that would also be interesting, as the most early responsive people might have been impacted early in the e-cigarette era. Any thoughts on that?
That's certainly very interesting. We never did that, but certainly something to look into going forward. We only focused on the past 12 months and did not go beyond that.
Okay, great. So I am not seeing any further questions. I think we are running early, given where we're at. And hang on, I think in that case we might wrap up, unless Revati, do you have anything else that you want to throw out since we have some more time?
I had a question, but it's more of it's not something related to the paper, but I was just thinking, because this is sort of your sample time period is till 2018, I believe, right? 2017 end. So there's a lot that happened, particularly in the US. You had the E-Valley, which sort of changed the relationship between e-cigarettes and cigarettes, like how people think about, because the risk factor associated with e-cigarettes just went up, even though the reasons behind that is totally different. But do you think like the relationship the conclusion that you have in the paper might have been impacted by any such informational shocks? Or do you think there is any reason to believe that they could change the relationship that you observe? Like maybe smoking initiation increased because now, when you look at risk perceptions, one became much more.
Yeah, certainly it will be interesting to look at the period beyond 2017, now that the flavors are more popular and then the bans on flavors have come about. So the relationships might change. And it would also be interesting to then compare how the relationship in the post federal minimum legal age period with flavor bans and with nicotine caps is different than what it was in the past without these additional policy measures in place. Certainly worth looking into.
Mm-hmm. Thank you.
And there's one more question now in the chat. Can you clarify your definition of smoking cessation? It seems to be successful cessation rather than cessation attempts. Is that right?
Yes, it's successful cessation. So if they said they quit smoking, but they also answered yes to whether they smoked in the past 30 days, then they're not counted. They're counted as quit. Sorry, as not quit. So they have to have said that they quit smoking and they would not have used cigarettes in the past 30 days.
Okay, great. And any other thoughts about sort of like how your findings relate to the broader literature on minimum legal sales age, and sort of whether you feel that these are consistent with sort of what's been found elsewhere, and sort of the benefits of including the initiation versus cessation?
So the broader literature and most studies find a substitution story. They relate they say cigarettes and e-cigarettes as substitutes. We find there's no effect, but then that may also be because we're basically digging a little bit deeper into the whole story and looking at the mechanisms. So substitution would mean cigarette use would have gone up, assuming e-cigarette use went down, whereas this might just be driven by a higher smoking cessation rate. A lower smoking cessation rate that could have driven this substitution relationship based on our findings. So I think it's important to then dig into the details of the substitution versus complementarity story, which is what we're doing in this paper.
Okay, I think we will give everybody back 15 minutes of their day. And Chris, do you want to take us out? Thanks so much.
Thank you very much.
Great. Great. That's it for today. Thank you to our presenter, moderator, and discussant. Finally, thank you to the audience of 185 people for your participation. Have a top-notch weekend.